In breaking news, the Eastern Cape Department of Health confirms that 6 children from Msintsi Location near Berlin and 1 child from NU3 in Mdantsane were admitted to the Cecilia Makhiwane Hospital today with suspected food poisoning. The children, aged between 4 and 7 years of age, presented with symptoms including vomiting, diarrhoea and dizziness, and sadly 2 of the children were declared deceased on arrival at the hospital despite resuscitation efforts by clinical teams. 5 others remain under medical care. For more on this, let's speak to Camagwini Mavovana, who's the spokesperson for the MEC of Health in the Eastern Cape. Camagwini, thank you so much for your time. So what a tragic incident. Now, I am fortunate enough to have heard your official voice note and read your statement, but please bring us up to speed. What actually transpired here resulting in the death of these 2 innocent children?
Good afternoon, Alicia, and good afternoon to the viewers at home. Thank you so much for giving us the platform. Really tragic news coming out of Berlin and Mdantsane in the Eastern Cape today. The information that we've been given by our officials states that at around 3:10 today, 7 children ranging from the ages 4 to 7 years old arrived at Cecilia Makhiwane Hospital. They were showing symptoms of diarrhea and vomiting and dizziness. And when most of those children arrived, they were in a very, very critical condition. And 2 of those children, as you have stated, passed away. Our clinical teams did try to resuscitate 2 of the children, but it was already late. And the two children have now passed away. The other children remain very critical, with 1 child having now been taken to Frere Hospital because our facility there will be able to deal with the urgency of the particular case. And we wait to hear from our teams what may have been the cause. We have spoken to the families, and as of now, the families are stating that the children were eating snacks before this tragedy happened, and they quickly rushed the children to the hospital. The one case from NU3, we don't have the exact details, but we do know that that child was also showing similar symptoms, and they are also in hospital at the moment. Outside of that, police have been alerted, and our environmental unit has also been sent to go and investigate the information surrounding this particular event. But that is the information we have at hand, and will allow the police to also do their parts and really investigate what has happened here.
I understand it's still too early, of course, as investigations ensue, Camagwini, but according to a statement as well, the department has swiftly activated, as you've just mentioned, its emergency and outbreak response protocols. What does this look like in essence? Are you scared there might be more such incidents? And where exactly did these sweets come from that the kids had consumed? Do you know?
Thank you so much, Alicia. That is the information that we still want to investigate, and that's why we quickly alerted the police. We do not want to be alarmist or create panic around that particular community, Msintsi in Berlin and in Mdantsane in NU3. We want to ensure that the families who are around those areas are also not going to panic, albeit that police and our environmental units and our top management from the department have been sent. Right now, that particular zone has been cordoned, and I think that the people in that area have been officially updated about the actual incident and what may have happened. We're still trying to find out where these snacks came from, the snacks that the children were consuming whilst this happened. But that's information that's still up in the air, Alicia. And we, as I've stated, we don't want to be alarmist in our approach, and we just want to make sure that the people in that community stay safe. As of now, the area has been cordoned. Our environmental unit is on standby to see where the source may have come from. And I think once we've established those facts, we'll come back to SABC and the show just to give a detailed response about what may have happened.
And I know you've just mentioned in terms of the community and the fact that you have effectively communicated with them, but what is the clarion call to communities in this area then at this stage, Camagwini? Where can they also get additional information in regards to the ongoing investigations?
Our team will continue to be there. They have been stationed there. They will not leave. They'll also go back tomorrow morning to ensure that they spread the message within the community. Right now, as I'm speaking, our teams are there. They are going to speak to each community member within that particular area. They are going to do door-to-door visits to tell them about what has happened. I'm sure, Alicia, you may have heard last year, there was a series of these cases that happened. And I think since then, we as a department have been ready in the way that we deal with cases of this nature. So right now, our teams are there, door to door, speaking to the family members in and around this area, and we will not leave up until we have established the facts, up until we have established what has exactly happened, where these snacks came from, and until we find out the source of the actual food, alleged food poisoning.
All right, we'll wait for further details. Thank you so much, Camagwini Mavovana there. She's the spokesperson for the MEC for Health in the Eastern Cape, with news just in there of sadly 2 children having died after consuming sweets in Msintsi in the Eastern Cape. All right.